Germany was one of the countries we'd all watched because it was seen to be handling the pandemic well. It entered lockdown light. That hasn't seemed to have worked, and comments in recent days suggest that the virus is out of control. So what has gone wrong in Germany?
Well, it's probably a mixture of things. We had a good start, as you said, and during the summer, obviously, we had a lot of easing off of restrictions. Then the traveling time and returns came, and I think there we got it sort of wrong in the sense that the awareness wasn't there. We didn't realize enough that this was coming on again towards the winter, and with all the other environment circumstances around it, cold weather, more indoors, and lack of really stringent measures, this is where we ended up right now.
Can I ask you about schools? Because what we've seen during the latest lockdowns has been that schools have been allowed to remain open, and this is very different from the hard lockdowns we saw earlier in the year. As we talk about vaccines that will not be administered to those under 16, I wonder what the ramifications are if we are seeing this greater spread because schools are remaining open. And clearly education is extremely important, particularly for those who've missed out on education in the final years, in the secondary years. What do you make of the threat, though, posed from schools and the spread of the infection as we talk about vaccines circulating but not to this area of the population?
Well, we have had a lot of discussions all around the schools, and the different federal states have had different approaches, I would say. But in general, the idea has really been to keep schools open as long as possible. There's been a lot of testing going on, and numbers were counted on a daily basis almost. So it has been the feeling here that at least the schools have not been the drivers of the infection. We have had infections in schools, but certainly not to such an extent that they were seen to be fueling the epidemic in any way. So this has been the approach, as I said, in different federal states somewhat differently, but and now there will be even more testing, and now the schools are basically closing down, so they are now in the game of the lockdown as well.
Professor, we're all learning so much more about epidemiology than we ever did, so luckily we have the likes of you and Anders Tegnell and others to talk us through this. Have we now put to bed the idea of herd immunity by letting large amounts of populations get out there and mix and just shielding the more vulnerable as well? Is that idea discredited now, or actually is there still legs in it, sir?
Well, it's certainly not been really a core idea across many countries, as we discussed early on in the epidemic. And that maybe Sweden was considered to go towards herd immunity for a while, but basically it's not been the idea that was being put forward. What we are looking towards herd immunity now is really that with the vaccination we will be able to reach herd immunity. That's the sort of prime way to reach herd immunity. But I think we've seen too many, serious cases, too many problems in the hospitals, too many deaths, especially now also here in Germany. So this idea just doesn't survive on the basis of letting the infection just roam around. That doesn't work.
And yet, sir, this is stunningly infectious, but actually, as in terms of a mortality rate compared with something like Ebola, it thankfully has a very low mortality rate compared with that as well, despite, again, the stunningly high infection rate as well. Have we... Again, a controversial question, but have we gone too far in focusing on this, despite the consequences for a whole host of other illnesses, a whole host of other diseases? I note in the United Kingdom, the enormous backlog of cancer treatment cases as well, the mental health implications. Have we got the balance right, sir?
This is a serious issue, as you say. I mean, we do have problems with other chronic diseases, and we have a syndemic. We have this corona infection on the back of a major problem with chronic disease, especially in our countries here with an aging population. That is quite right. And some of the treatments, some of the approaches, some of the therapies really haven't been getting to the people where they need to be, and our hospitals have focused on other things. So it's been hard to get this balance. And I mean, it's really one needs to go to the hospitals and see what they have been trying to cope with, where the corona cases are. They are really not able to cope in many ways anymore. So I wouldn't say we've got the balance wrong. It's just really that there are a lot of requirements, and to get through this safely has just been a major challenge. And we'll need to see where we get now, and the immunization you talked about, the vaccination, that will really help us out of all this.
Professor, why doesn't Europe have emergency approval at this stage when the UAE, Canada, the United States and the UK have already vaccinated their first patients?
Well, as has been said, the EMA has put their approval date ahead, I guess, so it's going to come also quite soon. It's a matter of days indeed. So I mean, my argument is that it's really the main issue of rolling this out well, getting it to the people who need it, and the logistics over the next few weeks and months will be the crucial point. I think we have had this discussion here: how safe is the approval process? Is everything going well? And I mean, the trust in all this has been a major issue, also with the criticisms against vaccination here. So all in all, I think this is just how it goes. Not everything goes exactly at the same time and the same way. So we'll be happy to have the vaccinations here as well in Europe. But the few days now, I mean, UK is ahead and other countries are ahead. That I don't think is a real game changer for the time being with this few days.
But Professor, would you have preferred perhaps that the Robert Koch Institute or other local regulators in different national countries in Europe had been allowed to approve and set their own logistical agenda? It does seem overly cumbersome and slow to have one overarching regulator run the process for 27 countries.
Well, it's been a good process over the years, when there was not this major pressure, I think, and it's been well established, and it has had its merits, and I mean, the UK was always in this as well in most decisions. So I think it's an established process. But you're right. I mean, we would have liked to see them just walk the same path as others in terms of speed, and nobody has at least shown to me so far that the other regulators haven't done their job. So I mean, that's perhaps something that you would have liked to see. Let them move at a very fast pace. They have moved much faster than usual already. So it's just these 2 weeks now that we are behind, I guess.